Good afternoon, ladies and gents. Very quick short video regarding lordosis and kyphosis. I've had a number of patients of late coming in saying they have been diagnosed by a therapist of a certain type who has said, I've got lordosis of the spine or I've got kyphosis of the spine, and they're walking away with the idea that this kyphosis or this lordosis is the cause of their symptoms. Spine. Cervical spine, thoracic spine, lumbar spine, pelvic girdle. Anterior view, so seeing the patient from the front. Posterior view, seeing the patient from the back. Lateral view, seeing the patient from the side. The spine has naturally got its curvature, what we call AP curvature, as in anterior posterior curvature. This means curvature on the back when you see it from the side. This is a normal lordosis. This is a normal kyphosis. This is a normal lordosis. So you actually are meant to have lordosis and kyphosis. Cervical and lumbar spine lordosis, thoracic spine kyphosis. So this is merely a clinical finding. What are you not meant to have? Hyperkyphosis or hyperlordosis. So increased curvature of the spine. Increased curvature of the spine in that respect, and also in the lumbar spine you could have that. That's excessive curvature. Alternatively, you could have reduced curvature, so what we call reduced AP curvature, so therefore the patient is hypolordotic or hypokyphotic. These are findings. So for somebody to walk away with the concept that they have lordosis of the spine is absolutely incorrect. It is nothing but a mere clinical finding. It is in fact the normal. It is the norm from a clinical viewpoint, from an evolutionary viewpoint, from a physiological viewpoint. Okay, that aside, can we have conditions associated with these things here? So hyper and hypolordosis or kyphosis, and the answer is yes. This reduced AP curvature you usually see on somebody suffering from ankylosing spondylitis, what we call bamboo spine, albeit in the later stages. That's what you see there. In the lordosis and the kyphosis, so with the cervical spine, for example, hyperlordosis in the cervical spine, that would predispose you potentially to headaches from symptomology viewpoint, and otherwise osteoarthritic change at the C5, C6 level, which is the most common level of arthritic change in the neck. With regards to the lumbar spine, your ethnic group, the Afro-Caribbeans, they usually have hyperlordosis. They have a local extension at the L5S1. What does that predispose them to? Disc issues at the L5S1 or 4-5 level. So you can have disc herniation, sequestration, and prolapse. Or you can have what we call a spondylolisthesis, forward displacement of the vertebral body. Now that also splits into two, retrolisthesis and enterolisthesis. Enterolisthesis being significantly more prevalent by far and large. That then is graded, grade 1, 2, 3, 4, depending on what scale you use, and if it's in excess of 50%, then your surgeons are the ones who will intervene, not somebody like me and any other manual therapist that might claim to. I'd be cautious of. You cannot retract an enterolisthesis. No, you can only do that surgically, and that is because you are predisposed to aortic equine syndrome, which is a medical emergency otherwise, albeit not in context. In theory, textbook, yes. In practice, I've come across a number of cases, it's not necessarily an emergency per se. However, clinically, we would always refer for an MR scan to determine the extent of the damage. Okay, all that aside, that's what you get there. With this, in the younger adolescent male, you can get Carvey's disease, you can get Schumann's disease. So yeah, there are associated conditions with increased curvature, hyperlordosis, hyperkyphosis, and on the other hand you could get it also, like I say, with hypolordosis or kyphosis. But it is absolutely normal. In summary, it's normal to have the lordosis and kyphosis of the spine. It is not abnormal. If you're not familiar, if that was too far-spaced with regards to the anatomy of the spine, you can always go back to the other video on the spine, whereby I've actually explained what the C-spine, T-spine, L-spine all stands for. That will give you some clarity and help you to come up to scratch with regards to the anatomy here. I hope that helps. Thank you very much.